coma to break up that connective tissue, because just lengthening the muscle and massaging the muscle wasn't doing enough, because that lipoma was still holding a lot of stuff in place. So just to massage around, the edges of that lipoma to break it up to really release everything.
Very
So
cool.
we can massage them, and in that situation, really massaging and loosening up that connective tissue.
Very cool. So lipomas are fatty tumors that have connective tissue kind of holding them together, and they're usually not painful, and you can probably even massage them, it sounds like. Unless they're painful, it's a local contraindication, and they can even cause structural problems because they can hold tissue tight.
Right.
Right? Cool. Excellent. Excellent. Thank you. Thank you, thank you, thank you. Perfect. All right, good. Glad you went first. It was quiet. You're right. She had to catch that moment when the kids weren't there. Yes.
That's because I like all you guys, and I know you wanted to listen to my kids fight, because that would have happened at some point during that time frame.
Yes. I will pull this lipoma over right now. Okay. Hey, Miss Trotter, trust me on this. Just go. Because you're nervous. Just go. Just do it right now. Get it over with. Tell us what you got.
All right, hang on. I'm going to try and present my
Wow. Okay.
material.
By the way, people, you don't have to have visual materials, but
Yes,
it's fine to have them. No, I think it's great you do. I just don't want other people to feel intimidated. Okay.
Well, this is me, so.
No, this is great. This helps you. All right, we can see shingles.
And yeah, I don't know what's going on.
So just go back because you're perfect.
Yeah. I'm struggling over here for a
Take your
second.
time. Take your time.
Okay. So, first, I had shingles. So that's what I'm talking about. So what shingles is, it's a viral infection. It's pretty much a painful rash that can turn to blisters. The blisters, they can open, and if they do open, they will crust over. So they're kind of like a lighter form of a scab. Shingles, they're painful, they can burn, itch, they can cause numbness or tingling, and they're really sensitive to touch. And also, when you get shingles, or if you're about to get shingles, like when they're about to start forming, it can cause you to have a fever, headaches, fatigue, and you can be sensitive to light. It can show up on any body part, but it mostly commonly shows up on the right or left side of your torso, and is normally in like a stripe formation. It comes from like chicken pox. So if you have chicken pox, like from when you're younger as a kid, I guess it's like a dormant type thing in most people, and like 1 in 3 adults, like 1 out of every 3 adults normally gets like shingles. So it's just kind of like something that randomly just can like activates in you. Didn't really find out like why it activates. I'm sure there's a reason for it, but I didn't find it, so I don't know. But you can lower your chances of getting it if you gotten your chicken pox vaccine when you're a kid, or if you get the shingles vaccine. I guess like it's more of a thing that you would get during like when you're an adult, but I'm sure you can get it earlier in your life stages too. And then you can massage with shingles, but majority of the time you wouldn't really massage a client with shingles, just because normally they're in a lot of pain, but it is a local conjugation majority of times, because it is in just that one area, but in some cases it can be more intense and would be like either a huge area or part of the body. Like I've seen some pictures where it's like pretty much the whole back, or like they have it like on multiple parts of the body, so it could be more than a local conjugation, but normally it is just a local one. Um, but it is recommended for you to avoid areas with rashes because that's what it would look like when they are not super bad shingles. So like it was just they recommend you just to avoid the area if the person doesn't really know it's shingles. Just to avoid discomfort for the client and also your chance of it getting whatever it is if you don't know exactly what it is. Um, and then if you do touch shingles, you shouldn't get them. But the chances of like if it's open, you could get the chicken pox if you didn't have the chicken pox when you're younger. So like chances of you actually getting it is slim, but if it's open and you do rub it or touch it, you could possibly get it if you have a cut or open sore. So.
Yeah.
I do have pictures. I don't know if you guys can see them because
We
I
can.
can't really see you guys.
We can see them.
But there's some pictures. One pretty much shows like the difference between chickenpox and then also shingles,
Well done.
but also like a kind of funny cartoon thing. And then there's also another one down in the other corner saying like they're back and it's the chickens with chickenpox on them. So.
Beautiful.
I have any questions or comments.
Ms. Trotter, I have a question. It's not a difficult question. I really want to ask you this. How do you feel like you did on that presentation? I know that is a really rough question to ask somebody, especially in public, but I really want to know. Trust me on this.
I know that I definitely rushed,
Oh,
but that's just me on presentations.
so here's why I asked you. I'm sorry, it's not a very fair question to ask, and it puts you really on the spot. And I really don't mean to keep putting you on the spot. I asked you because I was curious how you'd perceive your performance, because I would suspect I know what I think, but I would suspect the other people would say that was a solid presentation, right? It had visual aids, it flowed, you actually didn't stumble hardly at all. Not that I care, by the way, you guys can stumble all over the place, but you actually did something that, like it was just a very, very good presentation, and I suspect you don't see yourself that way. And I just wanted to reassure you that you might be like throwing up inside, but externally what we see is just an ordinary structured presentation that was actually very good. In fact, what I was going to tell other people, I hope people don't take this the wrong way, but you don't need as much information as she gave. I was like, just give me, a couple of minutes. But Ms. Trotter, that doesn't mean you did anything wrong. I'm just trying to explain to you, you exceeded expectations, and so you need to kind of give that to yourself. Okay? And I'm going to leave it at that. You're off the hook. I won't call on you for the rest of the day. You did awesome. Thank you. That was really good. Everybody, shingles are chickenpox. Once you get chickenpox, you have them for life. They're in your nervous system. They hide out there and hang out there. And if you get stressed, they can pop back up again as an adult, and they're not usually as big an outbreak, but they're very painful. And yeah, if you see a weird rash on somebody, don't touch it. Whether it's shingles or not, don't touch rashes. They don't want them touched, and they could be contagious. And that was really good, Ms. Trotter. Really good. Yeah, really good. Thank you. Really good. You should feel very good about that. I would feel very good about that. Okay. Can we try some? Miss Jung, how do you feel about talking to us about you and Miss Karodi? I thought we're going to present together. Did you know this even? Maybe you didn't. Maybe it wasn't obvious. Miss Karodi? You and Miss Jung were going to tell us about burns. Did you know that?
Yeah.
Oh, okay. Can you try and tell us? Both of you?
Yeah.
Okay.
Burn is the
And
constant.
And by the way, can I stop you for 1 second, Miss Crody? I'm sorry. It is fine if your husband or June or who's ever helping you guys helps too. I don't want you to feel like you can't have help. Whatever works best for you. Whatever works best for you. Okay, but anyway, go ahead. Go ahead.
You want me to ask you the question? Like, what is a burn?
Yes, what is a
What
burn?
is a burn?
What burn is burn is like the constant damage.
Cause damage to all three.
layers of skin.
Yes,
Yeah.
Got it.
very good.
And the
So-
first burn first burn for the damage dermis, hypodermis, like a sunburn. Second,
A good example of first degree burn is sunburn.
like sunburn.
Only damages the epidermis.
Second, second degree burn, first, hypodermis and dermis and the lateral for skin that we say like a scar.
Okay.
Yeah, so it can leave a scar, and it affects the first two layers of skin, the epidermis and dermis.
Yeah.
And it's more severe than a first degree burn.
Yeah. It's Taylor's third burn, and Taylor's MERS and the MERS. And maybe hair glands.
So the hair follicles and glands can be affected.
Yeah.
And your epidermis and dermal levels are completely destroyed. It destroys
Yeah.
both of those levels.
But this company have the scar, but that will get you off, like it's getting you
It
yeah,
can heal.
get healed. In the four levels, in the burn is like a Kato's all sliders skin, that skin, and can't go down to the burn like a bone.
It can go to the bones and muscles.
Or
That's-
muscles.
Yeah.
Okay.
Yeah, they have to do the surgery for the infection.
And that's third degree?
That's broad.
One more time? That's,
She was describing the fourth degree burn.
oh, which goes all the way through. Got it. Okay.
All the way through to bone and muscle.
Yeah.
I learned something. I'll tell you in a second. That's good.
And so
Okay.
what causes a burn? Like what causes a burn to happen?
Transfer like a sunburn, and fire,
Sure.
power, anything hot is in the body like a hot, like a skin something. And maybe have like a chemicals, cold.
Yeah, good point. Chemicals, all sorts of stuff.
Yeah.
I just need to ask one question. Is it a local contraindication or an absolute contraindication? Do you know what
Well,
that?
it depends on how bad the burn is, but
Yeah.
if you burn your finger, is it what is
Yeah.
local, right?
Yeah. Right.
Good, good. I love it. All right. Okay.
And
Yeah.
So,
one more question for her. When you're gonna massage a client that has a burn, what should you do?
I would try to have a burn any burns I saw first time. I will ask is it okay? So after that skill I have started, they want me to do the massage. I have to figure out that okay. Even they want me to do the massage. That anything if something bleeding or something and I feel really good to start, I will not do. Even they don't want to pay, I don't care. I don't want to hurt someone, I got troubles.
Got it.
Yeah, I know that people have sunburns, they want to do the massage. I will do, but like, not the rub really hard, I will like push in,
A
you
light,
know,
a
stop.
light massage. Yeah, that's true. Okay. Good.
And then hold top first, hold top, maybe better. I'm comfortable.
Perfect, Miss Crotty. Perfect. I'm going to recap that if I can, but that was really good. And Miss Jong.
Yeah,
Did
she would like to try.
Yeah, please. I want her to. I thought they'd be sitting together. This was my master plan that did not work. But don't worry.
They were, yeah.
So
Okay,
Miss-
Would you like to try?
yes, what can you tell us about burns?
Yeah, 我说过。
说吧。
Yeah, the skin has two layers.
Layers. Yes, skin has layers.
If the first layer is burned, it might not leave scars.
Okay. That's true.
If the second layer is burned, the skin will leave scars.
That's it.
Yeah.
Yeah, okay, good. Anything else?
That's it.
No, that's good. That's good, okay.
Thank you.
Thank you. So,
Thank you.
I can't imagine how unbelievably stressed I would have to be if I had to give a presentation, even one sentence long, on burns in China. So I really commend you two. Thank you. And by the way, I don't even want to admit this, but I think you guys should know. I knew, by the way, I learned something during the presentation. Such
I
an
can
idiot.
see she's
I-
very nervous.
Yeah, I'm very nervous now too. Here's what I learned. I knew that, by the way, 3rd and 4th degree burns were worse than 1st degree burns. I knew that. I've known that forever. I never, ever put it together with the layers of the skin.
All right.
Okay, I've been teaching this forever. It never occurred to me that 1st degree burn just affects the epidermis. And then Ms. Jong explained to us too that that's why it probably doesn't leave a scar, because the epidermis is sloughing off all the time. Remember, you got to get a tattoo, you got to get down the dermis. And then a 2nd degree or worse could leave a scar, but that didn't occur to me. They call it a 2nd degree because it gets down to the 2nd layer, and a 3rd degree gets down to the 3rd layer, and a 4th degree has gotten through all the layers, and so it's hitting muscle and bone. I'm sure that all of you knew that, but I did not know that. So, thank you, because now I have, this is the kind of presentation I want actually, is this very simple concept that Mr. Tapscott can digest. I'm a simple man. So I love this. So we now know 1st, 2nd, 3rd, and 4th degree burns. Well, now remember that 1st degree burns are the least to worry about. They're only hitting the epidermis. We can tie it to our layers of skin. 2nd degree is dermis. 3rd degree is hypodermis or subcutaneous or superficial fascia. 4th degree is bad news bears. We also heard that essentially mild burns are local contraindications. You can avoid just that area. Obviously, if somebody's majorly burned, their whole body's having problems, they're not going to come see you anyway, but you wouldn't massage them. And then Ms. Carodi was even kind enough as to kind of explain to us that people come to her with sunburns and things like that, and sometimes she does work on them, which I do too. If it doesn't hurt the client, I still work on it. But she's more careful so she doesn't irritate that area. By the way, the books will say never, you just don't work on it, but that's not true. People have sunburns all the time, and some people it doesn't bother them at all, and you put some nice oil on them and you massage them anyway. Fantastic. Cool. Thank you. Thank you, thank you, thank you. Thank you. And thank you for being so brave. So brave. Oh my gosh, I was getting nervous. I'm serious. I really was. Very good. Yes, that's my flower? Thank you. Miss Sarno, could we have you go next? Because I know it's challenging. That's why I'm calling you guys first. Just get it out of the way with. So, Miss Sarno,
Yeah,
you
I
said
can do email. I can do email about photo and
okay. Hold on, you did. I saw it. Just give me 1 second. I will. Let's see. Where is it? Hold on. You did, by the way. I remember seeing it right before I came in here. I got all excited. Let's see. Oh. Wow. Okay. Hold on. She's got images here that I can probably pull up here too. Let's see.
because my printer not working.
Yes, no problem. I'll tell you what, just bear with me everybody. 1 second. We're going to drop these right in to your slide. Okay, hold on. Duplicate. Boom. Hold on, I'm going to put them in your slide thing so I can show them to everybody. Hold on, bear with me. Insert picture. Downloads. Okay, hold on. You sent me 4 pictures, so hold on. Insert. Okay. Just about done. Boom. These are good pictures. Okay. So, hold on, Miss Sarno. Last one. Okay. highlighting them so we can see them. These are good. All right. Yeah. Okay. Okay, Ms. Sarno, I'm going to start showing these too. Let's see, slideshow from current slide. Boom, boom, boom. Okay. I'll share this. And can you talk about it? Can you try?
Yeah, I can try, but I worry about I cannot pronounce some.
Oh yeah, don't worry. We probably can't pronounce it either. But so you're going to tell us about ringworm, right?
Yes. Yes.
Okay. Just do your best. Try. What is ringworm?
Lingam is common for function in infection. Uh, like Like you Google.
No.
I just.
It's okay. Let me help you with the first sentence. So what she just said was she said ringworm is a common fungal infection. It's a fungus. And some people call it tinea, I think. Tinea, but it's a fungal infection. And everybody can see the beautiful fungus here. What else can you tell us about it?
And mostly like affect to the skin on the body, the rash, the feet in on the
Groin.
Yes.
So-
I don't know it.
No, it's all right. You're doing great. So ringworm most commonly affects skin on the body, the scalp, and this is not the scalp obviously, but the scalp and the feet and the groin, which is always lovely if stuff affects your groin. Yes. Anything else you can tell us about it?
And they will get like itchy and hurt like. I just can't know it. I didn't know this. Okay, can.
Well, it's itchy and it can hurt.
Yes.
Yeah.
Okay.
Can we massage it?
No, we cannot massage it. We have to go see the doctor and have the doctor look at. And
That's actually pretty good right there. Is there anything else you want to tell us? That's actually about all I would have said, to be honest with you.
okay. This bit of for right now. I just get nervous.
Yeah, no. That's what we're doing today. We're all just getting used to peeing in our pants in front of other people. That's what's good. Okay, you did a great job.
Thank you.
Sorry, that's just my expression because that's how I feel when I get nervous. I'm like, ah! So what Ms. Sarno so kindly told us was ringworm it's got that name because it looks like there's like a little worm underneath the thing, but it's a fungal infection. It's a fungus. It's actually highly contagious. And it's pretty noticeable because it's got that ring. And it can be itchy and painful and all that kind of stuff, but you probably shouldn't massage somebody with ringworm because you can catch it. And I've actually never seen it on a client because people don't usually come to you when they have it. But anyway, you'd avoid it. So that's an absolute or general contraindication when we just don't work on somebody. When we're like, hey, sorry, that looks like ringworm as I back away from you. But it looks funky. It really does look funky. And at the bare minimum, again, even if you forgot this entire lecture today, which could easily happen, we have a lot of days together and you have a lot of life going on, but we wouldn't rub rashes. Yeah? Wouldn't rub rashes. Okay, Ms. Sarno, you did good. It's very hard. It's a different language. And you did great, and we're fine. Cool. Yes, thank you, Ms. McDowell. Well done. Yeah, we really appreciate it. This class, by the way, does not award, nor does life, high performance. It awards trying hard. That's how massage works, trust me. The best massage therapists just work hard. Mr. Brown, yes, sir.
Oh, great. Thanks for calling on me next. I'd love to go.
Oh, cool. I'd love it too. So, Mr. Brown, you were going to tell us, I believe, about athlete's foot.
I just thought that I should go next because mine kind of segues after ringworm.
Yeah. I love your thinking.
I didn't make like a PowerPoint or anything.
No, you did not need to, sir.
Like,
You didn't need to.
so mine is mine's athlete's foot. It's also called I don't know how to pronounce it. Tianus pedis.
Yeah. That's
It's just
yes.
Another form of ringworm.
On your foot.
Located on your foot. Yeah, just on your foot.
Although
And it's like when you wear like tight shoes.
Yes. Okay.
And like you're sweaty and tight fitting shoes. And it's like followed by like the picture. I didn't want to include pictures because it was nasty. Apparently I should have according to Mr. Blygen. But it's like it looks like you're like peeling between the toes. And it's like red and like a rash. At first, I thought it was going to be a local contradiction.
Yeah, it is.
Because you just avoid your foot, but after you said with ringworm...
No, athlete's foot is local contraindication.
Okay, so, because I was like, yeah, just leave your socks on and avoid the foot, and you'll be fine, but, okay. And,
Also,
what else did I have here? It's basically, you can just self-treat with medication, antifungal, and you'll be good.
Yeah, and by the way, I don't want to gross people out, but you might have worked on somebody without knowing it that had mild athlete's foot, and you just didn't know it, and that's why we wash our hands afterwards. If there's no cracks in your hands, you're probably fine. Athlete's foot likes really warm, moist environments, and so not just tight shoes, but those nice sweaty environment that's in our shoes right now as we stress about our presentation. That's great for athlete's foot, and to be honest with you, if you wash your hands afterwards, it's pretty darn hard to catch. Good job, sir.
Oh, and another thing, it's easily, it says that it's easily transmitted by skin and skin contact.
Yeah, if you don't wash afterwards, it can be a problem. The reason it's a problem between people's foot is people don't wash their feet as much. Like in a gym, in the locker room, their athlete's foot's getting spread out on the floor, and then they stick that foot inside a shoe and a sock, and it's all nice and baking in there, and that's the problem. That lets it grow. It's a plant, basically. It's a fungus, and mushrooms like dark, humid environments. But your hands, if you wash them and dry them, all of a sudden doesn't have an environment like that. You've washed out the spores, you've done all that stuff, it's all good. Cool. All right, thank you. Mr. Blygen, why don't you tell us about acne?
Okay.
Yeah.
So acne, I think most of us have probably either have it now or have experienced it. I did when I was a teenager. I had really bad acne that probably was due to like hormones and puberty and everything like that. So my acne was pretty bad. I ended up finding St. Ives, which I've used ever since I was like 16. That really helps with blackheads and getting all the skin and pores cleaned out. And so with that, acne is a skin condition that occurs when your hair follicles become plugged with oil and dead skin cells. And as we learned in the chapter, our skin naturally produces sebum, which is our natural body oil. And let me see if I can make sure you guys can see the picture here. So there's a little sac. This is page 557 in our book. So that is the little sac right here where the sebum is, I guess, generated, or there's a keyword that I found. But anyways, that's where the oil is made. And right here is the follicle sac, where the follicle. And that's a sac where the hair pretty much grows from. Yeah. So right where they meet, that's where the oil is generated, and then the follicle. So what happens with acne is when you have an overproduction, that's the P word. The P word is production. Overproduction of the oil basically clogs this pathway here where your hair is, and with that, it creates like a little pocket of bacteria, because you also have dead skin cells in there as well. And that creates the pocket, which we see as pimples or zits. And those are pretty common, and it can happen for a multitude of reasons. It can be from stress. It can be from a chemical, from not sorry, a chemical, but from like a medication that you're taking. It can do to your pH levels, menstruation. They kind of come and go. And with that, it is a local, well, it depends on the contraindication, because if you see some acne that's extremely inflamed and looks like it can be infected, then that would become like a local contraindication, and you wouldn't really want to massage in that area and just kind of stay away from it. Um, with that, there are some ways that we as massage therapists can help with acne. That would be just in general, doing massage helps to increase the blood flow to the body. Also by helping balancing the levels of pH in our body, detoxification, reducing the stress levels, and those are all the things that kind of increase the cause of acne. Excuse me. And also, there are certain types of massage. I saw that shiatsu can actually really help with acne, where the trigger point is done in massage or shiatsu, and you can focus the trigger points directly to certain organs that help stimulate circulation, which helps balance the pH levels in the skin and the production of the sebum, which is the oil that we talked about earlier. And also yoga is a great activity to help with acne by helping to increase the blood flow and improving circulation as well.
I love it. I love it. Thank you, sir. Yeah, so local contraindication, if anything, right? Just depends on if it's inflamed enough or not. I love that. I will tell you, by the way, I've never heard the shiatsu thing, although I completely believe it. However, I've kind of used the shiatsu thing for other reasons. I've had clients before come in and the acne on their back is so bad. It doesn't gross me out. It's so bad and it looks like it's going to rupture. And I'm like, I don't know how to rub this because I feel like I'm just going to break off pimples everywhere and stuff like that. And that's not healthy for anybody. And I've worked on those clients by doing pressure points through the sheet because they're like, I still want my back done. And I'm like, okay, well, let's go through the sheet and work doing pressure points, which is kind of shiatsu. And so it's just a great way because I'm always trying to find a way to say yes. Because I want the money coming back in and I want the client to be happy. And they want to get their massage. So good stuff. Cool. Thank you.
I also noticed,
go ahead.
too, like one day I didn't necessarily get to shower until I got off of work, and I kind of went straight from school to working, and I didn't get a chance to shower like after being massaged. So there was like some residual oil that was left on my body from the massage, in addition with the dead skin cells from whoever massaged me that day and my own. So I actually got a huge, like, nasty pimple in the middle of my back, which I don't usually have pimples or acne back there, but it was pretty big, and now it's kind of went down. So that kind of made me think about the description that I found when I did the research on it, how the oils and everything the pores get clogged pretty much. So it is important for us to shower daily. I do shower daily, y'all, twice a day actually. I just was kind of on the go and I didn't get a chance to shower that day, and I kind of suffered for that.
Thank you so much, Mr. Blygen. I can't thank you enough. I bet you're one of those little kids that, like, if you got in trouble and we just kept letting you talk, you just kept divulging more and more information. That's why I was laughing. I was picturing this. That is fantastic, though. Thank you. And thank you for, by the way, making it relatable and bringing it back to massage. I really, really, really appreciate it in so many ways. So many ways. Miss Estes, can you please talk to us about boils, since we're kind of in that realm already? And maybe tell us about a boil that you've recently had.
So I was definitely like, okay, what is the difference between a boil and like a whitehead?
Thank you.
Or
yeah.
And so I think, well, a boil is is kind of like a whitehead in that it affects like the hair follicle. But it's usually accompanied with some sort of bacteria like staphylococcal, I think, is that how I say it?
Yeah.
Yeah, it's usually caused by that, which is like, from what I've read, a bacteria that just kind of lives on the body, and in certain conditions it gets funky and creates
Gets funky.
a nasty environment, or something. But I usually, well, so I don't know like too much about it, so that's probably all I know about that exact process. But usually it's a bump that's formed, and pus is involved, just like a whitehead, but it's like more inflamed on the edges and kind of more enraged, I think, than some of the other like nodules or other, pimply kind of cousins of it. I don't know. I'm really just, I do have notes that I could read. I was just kind of ad-libbing, but so
You're allowed to read your notes too.
yeah, okay. So the most common places for it to appear are on the face or the neck, armpits, shoulders, the back, and the buttocks. When one forms on the eyelid, it's called a stye. We get those sometimes. And if several boils appear in a group, this is a more serious type of infection called a carbuncle. So sometimes you see them in clusters.
Yes.
Yeah. Definitely, depending on where it's at, so you want to do local, I guess, massage. If somebody comes, you don't want to, massage that area, but you can massage other areas. And let's see, folks with like a suppressed immune system or diabetes or poor nutrition or poor hygiene, those are the folks who usually, are susceptible. And a treatment, if you wanted to go like home remedy, could be apply a warm compress, and soak it in or soak it in warm water, and when then it'll start draining. You don't want to pop it, but you just want it to like start draining, and then you want to wash it with an antibacterial soap or a tea tree oil kind of thing, and then clean it with alcohol. And then you can apply like an ointment and then a bandage on it.
Cool. Good.
So yeah, so
you don't. Yeah, I don't know if this helps, Miss Estes, but you don't have to find something that's not there. Meaning, like some of this stuff, it's so. If you don't mind me interrupting, and not because you weren't doing a good job, that's not it. No, but there's not a lot to say about boils. Boils and acne are extremely similar. The difference is acne is really kind of like an infected little hair follicle. A boil is almost the same thing, but it has a particular bacterial infection in it, and it tends to be acne on steroids. It's bigger and looks more noticeable for that reason. It's just a local contraindication. There's no big deal at all. I just don't want you to feel like you were supposed to find some magical thing to say about boils. There's not much to say about them.
I know. Yeah, okay. Well, then I'll stop right there then.
Yeah, stop. It's good. Yeah, no, it's great. It's great. I just didn't want you to, I want you to feel like
and if you get it on your sheets, you gotta wash them, like bleach them, they're contaminated.
Yeah,
right?
Well, they do. They have the bacteria in them that creates boils and stuff. Although, by the way, not to freak you guys out, but most of your bodies are loaded with all the bacteria we're talking about. The thing is, it doesn't get out of hand because you shower regularly and you change your socks regularly and you change your sheets and stuff regularly. That's why the stuff doesn't get out of hand. But just to let you know, there's dangerous stuff everywhere, but your immune system and your cleanliness takes care of it. That's really how we make it. Anyway, thank you. Thank you for telling us about gross boils. Really appreciate that. Let's see. Miss Hawks, you were going to tell us about bruises.
Yes, I am.
Yes, I am. I like that.
Alright, so bruises, they are marks on your skin caused by blood leaking from damaged vessels.
Thank you.
Usually when this happens, like somebody runs into something, somebody gets hit, fall, So the color that you see usually on them are like, they're blue, purple, black, kind of gross. It's caused by this blood pooling underneath the skin. Usually bruises will fade to a more yellow greenish color after about 4 to 7 days when it starts to heal. The most common type of bruising is subcutaneous. So we learned a little bit about that with the skin. So it's just underneath the skin. Hematomas are a more serious type of bruise. So these are more painful, more swollen. These can affect the internal organs actually. So in some cases they do require medical attention. You definitely don't want to massage on them. Also, like certain things affect like your vulnerability to bruises. So being older is one of them. Being on blood thinners, various medical conditions such as bleeding disorders. And in relation to massage, bruises are usually just local contraindications. You just don't want to like press on them, massage on them. You always want to make the client aware of a bruise. And in some cases, like if they're really faded, and the client says that it doesn't hurt, that would be the only case where you could touch it.
Yeah. I think that was perfect. Did you have anything else to say?
That is all.
That's all I was expecting. That was fantastic. No, I meant, like, that's all I would say about it too. That's what I meant. I think that was fantastic. Bruises are bleeding under the skin. Now, it's stopped, but that's what the color is coming from. And in general, they mean nothing. I love that Ms. Hawks reminded us that you tell clients about them. Just ask them, like, hey, does this hurt or whatever? Because we want to make sure they know they've got a bruise and that we didn't cause it. And they basically are a local contraindication, and she's absolutely right. I've rubbed many a bruise when somebody's like, oh, that thing's 2 weeks old and it doesn't hurt at all. Then fine. It's 2 weeks old, it doesn't hurt at all. It's discolored a little bit because there's still some blood left under the skin, and it's fine. It's just not a big deal. Yeah. Really bad bruising deep under the skin is bad because you're internally bleeding. But that's a totally different thing. And you probably aren't going to have somebody on your table in that situation, and they're going to have lots of other problems. So thank you. Very well done. Very, very well done. Good job. Okay. Miss Lobitz, cold sores and fever blisters. That's right. You were going to talk to your husband about these and be like, give me a kiss goodnight. Yeah. That's right.
So cold sores are a common viral infection that can be reoccurring. It can also be referred to as fever blisters or the herpes simplex virus. They're painful, fluid-filled blisters that generally appear on the lips or around the mouth. They can appear in other places on the body, such as the genitals as well. We're not massaging the genitals, so I don't need to worry about that part. When the blisters break, scabs will form, and it can take a couple weeks to heal. The herpes simplex virus that causes cold sores is actually very common, and a lot of people have it. It can lie dormant in the nerve cells until triggered. An outbreak might be triggered by lifestyle habits such as stress, diet, fatigue, being sick with a cold, hormonal changes, or even some type of trauma to the face. Even though it's a common virus, not everyone will experience cold sores. It's contracted by close contact, such as kissing or sharing drinks or sharing face towels, anything that could come into contact with the infected area. It is possible for it to transmit even when the skin appears normal with no symptoms, but there is a greater risk when there is an active sore or blister. And as for massage, cold sores are a local contraindication. The area should be avoided since it is contagious, and per our MT book, the healthcare associated transmission is very low. So the therapist should avoid the face, be mindful when working the neck so you don't accidentally brush the area either. You could use gloves if you desire to, and then of course sheets should be thoroughly washed and sanitized along with the face cradle and work area.
That was perfect. That's exactly right. Yeah, the biggest problem with cold sores is the person usually feels very embarrassed about them. So I'm like, no big deal, I get those all the time. Doesn't matter if it's true or not. And then you massage them, wash your hands right away, don't touch your face. But you're fine then. You're absolutely fine. And yes, you can always glove up. I don't want to discourage you from gloving up, but I do want to tell you that unfortunately it makes the person feel weird, right? Because you're kind of like, ew, you know? And so I avoid gloving up unless I really have to. But with cold sores, I would say if you don't touch them and you wash your hands afterwards and you wash all the sheets, you are 100% fine. Very well done. Thanks, Ms. Lobitz. Ms. Manes.
So my presentation is on decubitus ulcers.
Yeah, you said that better than I do. Thank you.
The ulcers are considered a pressure ulcer, pressure sore, or bed sores. The injury to the it's an injury to the skin are caused by bedridden patients or clients. The elderly have the highest percentage in developing ulcers. Pressure sores are localized contractions created from prolonged pressure causing friction to the epidermis. Decreased mobility, fragile skin, increased moisture, and poor blood circulation in the bony landmarks or endangerment sites of the hips, back, ankles, and glutes create open wounds of the superficial layer of the skin. And there's 4 stages of bed sores. Stage 1 is red to the skin, red to the skin or to the touch. Stage 2 is involves some loss of epidermis and dermis. Stage 3 is necrosis, which is dead cells or tissue of the superficial fascia layer. And stage 4 is dead cells underneath the bones and muscles that can cause a severe infection. And so the treatment would be to recommend the client to reposition, if they have bed sores, to reposition every 2 hours. Yeah. And I will definitely proceed with the massage, just taking precaution and avoiding the infected area.
Cool. What kind of contraindication do you call that when you just avoid the area?
It's a local.
Yeah, well done. Thank you. Anything else, ma'am?
That's it.
That's perfect. So yeah, they're bed sores, and they literally are the bony landmarks of your body, which is the stuff that sticks out, right? We've got certain areas that stick out more than others. And they're pressing against a bed for a long period of time. That cuts off blood to that area, and the skin eventually dies. And so that's why they have to rotate patients all the time and stuff like that. And nobody would get one on your table, but somebody could come with one, and that wouldn't be out of the realm of possibilities, and you would just avoid the area. Yeah. Thank you. Thank you. Thank you. Ms. McDowell, I think you know I'm going to call on you next. Please explain to us what eczema is.
Okay, I have a PowerPoint, but I don't know how to get it so you guys can see it.
I can tell you.
Yeah, do I just open it up and then click present now?
Yeah, you have a couple of choices. But let's try it because I think it's a good thing to learn how to do. So, yeah, open it up. And I'll tell you a little trick that'll make your life easier once it's open.
How do I present it?
Well, that's what I want to tell you. So what I want to tell you, don't worry about presenting it yet. Hold on a second. On your slideshow, do you see the top tab? You got tabs along your PowerPoint? Yeah. Select the one that says slideshow.
Yep.
Under that, there should be something that says set up slideshow.
Yeah, set up slideshow.
Click on that.
Okay.
And then, right now, it's probably got a little black circle next to presented by a speaker full screen, right?
Mm-hmm.
Don't use that. Click the next one down that says browse by an individual window.
Okay.
Click on that and then say okay.
Okay.
Yeah.
Now. And then I click from beginning.
Yeah, now from beginning, and now it won't take over your entire screen, which is the first thing I was trying to do. So now you've got a slideshow kind of running off to the side, I hope. Or part of your screen.
No, I can put it to the side.
Yeah, do that way you can kind of.
You guys in another.
Yeah, do that.
Hold on. Okay, let's see if this works.
And then when you go to present now, you pick a window.
Any window, okay.
And then you click on the picture of your slideshow. Click on the picture of your slideshow and say share.
There we go.
Well, you think there we go, but we don't see it.
Well-
Oh wait, now we do! Bam! Eczema! We got it. Take it away.
Okay.
That's beautiful.
All right, so eczema is a general term for red, dry, itchy skin. I don't know if you guys can see it very well, but there's different layers of it. So you can have itching and dryness, blisters, bleeding, oozing, flaking, swelling, crusting, cracking, and redness is at the top.
Gosh.
So,
Okay.
yeah.
Sounds awful.
It's the most common skin condition. It's non-contagious, so that means if you touch it, you won't get it. It's got a bunch of different types, but eczema is just a general term. So you can get it on your elbows, torso, face, hands, scalp, legs, ankles, feet, anywhere you have skin, basically. Oh, wrong way. Doesn't really have any known causes, but it's thought to be related to hypersensitivity, like allergies, could be hereditary. Some people think it's like if you have a soap that irritates your skin, you could get some kind of eczema. I don't know because I don't have eczema, but if you get irritated and you're stressed, that sort of thing. In relation to massage, if you ask first, you can massage someone with eczema, but if the area is bloody, bleeding, or broken, it's a local contraindication. You want to avoid that. You say yes, use something that's very lubricating, so like an oil as opposed to like a gel or lotion to lubricate the skin. Don't use anything with essential oils because I found that can actually worsen the condition. So don't use essential oils, just use a hypoallergenic lubricant. Just dry, flaky skin.
Yep.
Okay, I'm gonna stop sharing.
Okay. Well done. Well done. This is probably the most important presentation that we'll have today because it's the most common. That's why. Lots and lots of people have eczema. They think it's stress related as well, which was in your slideshow. And people that I know, which is a lot, that have eczema say it's stress related. Like they think it might be other things too, but stress makes it worse. And the problem is when their eczema comes out, they stress about their eczema, which makes more eczema come out. They're terribly embarrassed about it, most people. We're very self-conscious already, and now you've got this scaly kind of stuff. It's not contagious. It's not a problem. You can actually massage it if it's not broken open and bleeding, which you said, Ms. McDowell, thank you. It's a local contraindication if it's bleeding because everything's a local contraindication if it's bleeding. And there's just nothing to worry about. The massage might help it just by calming them down. You can help them emotionally, though, by being like, oh my gosh, this is so common. I feel like I have hundreds of clients that have this, even though you're going to be fresh out of school and you have 3 clients. You got hundreds of clients that have this because you will. And you just want to reassure people. Like, I just love reassuring people when it's the truth. I don't ever tell them a lie, but it's the truth that everybody's got eczema. You know what I mean? It's the truth that it's super common. And it has nothing to do with them. And so, yeah, that was fantastic. Thank you. Local contraindication at the very most. Nothing to worry about. Looks like dry, scaly skin. Really, it's not a big deal. Unless it gets so dry that it bleeds and stuff. Yes, Miss Walker T.
Hi, this doesn't have to do with the eczema so much. Great presentation, by the way. But you were talking about the acne and how you were doing like first time through the sheet. How did you approach that situation with the individual?
I don't know if I heard you said, how did I approach the acne situation with what?
You said that you had someone came in who just had acne like all over the back and you were afraid you would just like break it open
Yep.
by rubbing your hands over it. How did you approach that situation?
I'm really glad you asked this because it's not just about acne. So one of the hardest things, this is the reason, by the way, I do this with you guys and make you public speak and all this stuff. The hardest thing I had to do when I got out of school and started massaging was talking to people about uncomfortable things because stuff comes up. And what I found out very quickly, which I probably already knew, was that if you don't talk about stuff, it gets much worse, right? And we all know that. But I'll be the first to admit, I might know it, but it's still hard to walk up to you and have a difficult conversation, right? And so, and I don't want to embarrass somebody, I don't want to do this, but what I found was I'd be in the treatment room and not address some issue, and then it became a really big issue, right? And so it really trained me through horrible situations. I don't mean because the client was horrible or anything, I meant because I didn't deal with some little thing, that I had to start like sucking it up and just being like, hey, your arm is falling off. Can we talk about that? That kind of thing. And so with the acne thing, I would just be really blunt but really nice. Like, hey, I would love to rub this, but I'm really worried about rupturing this. So can I work on this through the sheet? Not, I'm grossed out, not anything, just, I would love to rub this, but I'm worried about rupturing this. You know what I mean? That kind of stuff. And I started doing that with my clients with everything. So, and it just was very effective. Not accusing, not being, anything, just like, hey, I would really like to make you happy, but can I work on this through the sheet? I'm really worried about this. I told them the exact truth. I'm worried about rupturing this. I'm worried about popping open all these pimples. I just said it the nicest way I could, and they were like completely reasonable. They're like, oh yeah, I want my back worked on, but I don't blame you. Yeah, and that's it. It worked out just fine. And I would do that with other situations too. Let me just give you some, these are rare, but they do happen. I'm very sorry to say. I'd have a client who had their hands under the sheet, and I thought maybe they were touching themselves inappropriately, right? When I was fresh out of school, I'd be like, oh, I can't discuss that. Like, what do you tell somebody? And I just started addressing that stuff without accusing somebody of anything and just say, hey, sir, you're gonna need to keep your hands on the outside of the sheets here on the table. And people, by the way, would either be like, okay, or they'd be like, I'm not doing anything, and I'd always say, I'm not saying you're doing anything, that's just what you have to do for us to continue. And I was shocked at how well it all of a sudden worked. Really bad problems can really be resolved, I would do the same thing with you guys, like, hey, I really love you, but if you don't study more, you're gonna fail. Like, it's just a conversation we have. And both are true. I love you, and I'm gonna fail you. Because you're, and I just started doing that with clients, and it was so effective. So I just started talking about the elephant in the room. And I really encourage you guys to do that. As nicely as you can, just be like, hey, there's acne all over your back. And that's totally cool. I see, I get it. But can I work on it through the sheet? So anyway, that's what I did. And that's what I do to this day. And so now, it's still just as hard, but now I'm just like, we gotta talk about this. And that's all. And by the way, it's always cool to tell people what you need so you can complete the massage. Well, I need you to stay covered, otherwise I have to leave. I'm not mad, I'm not accusing you, I'm not anything. This is what I need. I need you guys to show up to class, otherwise you're not gonna pass. That's just what I need. So we just have those kind of discussions, it really helps. Let's see. I hope that answered your question, Ms. Walker. Where are we now? What was that? Okay. Who knows? Miss Allure, you were going to tell us about scabies.
Unfortunately.
Yeah. We gave you a good one.
Right. Scabies is an infestation of tiny mites that burrow and lay eggs inside of the skin, and it leads to really, really bad itching.
Yeah.
And usually when the mites poop and lay eggs, the itching gets really, really bad, and that's usually at night. It spreads from direct contact with a person who has it, or it's easily spread through sexual contact, but you can get it from bedding, clothes, and furniture, and things like that. the treatment would be with topical medication or oral medication.
Yeah.
I did find out that tea tree and aloe vera is also a natural approach.
Good to know.
And it's very common. There's about 200,000 cases a year. And as far as massage goes, you would not massage them at all. It's an absolute no.
Because it's highly contagious, everybody. It's super duper contagious. I've never knowingly had somebody with scabies come to see me, but I have talked to people with scabies before. It's super contagious, and unfortunately, skin-to-skin contact, it's one of the few things that you can catch, just skin-to-skin contact. Don't sleep with your clients with scabies, and that's a joke because you're not supposed to sleep with your clients at all. But the fact is, the skin-to-skin contact alone. So if somebody was to divulge that, you would not work on them because it's basically little bugs and they can get around. Yeah, really good point. But super common, and they treat it with medication and get rid of it. Thank you, Mr. Laura. And I not everybody's now itchy every time we do something like this. You're like, yeah, good stuff, good times. When I used to work with the homeless individuals, it was a real problem because it's hard for them to stay clean, and they're sleeping close to each other and things like that, and scabies is terrible and stuff like that. That's a real problem. Okay, fun stuff. My gosh, you're very welcome, by the way, Miss Allure, for having such an enticing topic. I saved that one for you. Miss Munoz, would you want to tell us about impetigo, or will you even if you don't want to? Are you there? Oh, you are. Miss Munoz, you're there. Can you hear me? She's like, can you unmute yourself? You're still not unmuted, just so you know. But I'm patient. Can you hear me, Miss Munoz? Yeah.
Is it the same thing as chiggers, the scabies, or the?
Is it the same as chiggers? Is that what you said? I don't know. I don't know. I feel like chiggers are like ticks. Yeah. But anyway, let's talk about it in a second.
Yeah, I wasn't sure. Okay.
Yeah, thank you. Just because,
Okay.
Miss Munoz, we got you.
Ready?
Good. Tell us about impetigo.
Okay, so impetigo is it's a common and contagious bacterial skin infection. It is caused by strains of staph or strep bacteria. It's mainly around the mouth, the nose, and skin folds. And it is also known as the school disease. It really affects children ages 2 to 5. It's not really common in adults. And there are 3 stages, which are non-bullious. That's I'm saying it right. That one's the most common. And then bullious is almost always caused by the staphylococcus. And the third one is the Ethym. I don't know how to say the word. It's ECTHYMA, and that one's more serious, but it's less common.
Got it.
And that happens when it goes untreated. So, impetigo is treated by antibiotics, and to prevent the spread is just good hygiene.
Yeah. Is it a local or an absolute contraindication?
It says it's a local. You can wear gloves, then the lesions must be covered.
Yeah.
But you can catch it by touching like the towels, clothes, the sheets. I personally would not massage a person
Yeah.
But it says it's a local contradiction.
Got it. Cool. Anything else? You don't need to have anything else. I'm just asking.
Nope, that's it.
Good. Yeah, I appreciate what you're saying, and I'm sure it does say local. Most people consider it an absolute contraindication. It's very contagious, but again, it usually affects kids. You probably won't ever see this in your massage room. You might see it with your kids,
Right.
but you won't see it in your massage room.
Yep.
That was fantastic. Miss, how do you feel about all that, Miss Munoz, about presenting and everything?
I'm shaking in my chair right now.
Yeah.
Very anxious.
Awesome. You were very kind to say anxiety is a challenge for you, as it is for many people here. I hope you will pat yourself on the back that you just faced a major fear.
Yeah.
Yeah.
I will.
And you're done.
Thank you.
And you're done, and you have a 4-day weekend. I'm serious. This is a big deal. Like, if you're somebody who's got anxiety and you talked in front of a group and got through it.
Yeah, I know. I'm sweating.
Yeah, but you did it. Yeah. I'm very proud of you.
Thank you.
I'm very proud of you. Good.
Thank you.
Good. Mr. Placencia, tell us everything you know about lice.
Okay, so interesting story. Back when I was in middle school, I had long, curly, flowing hair up my shoulders, right now, and then I unfortunately got lice somehow.
Sure.
But I was too embarrassed to say anything because of all the middle school kids. So the problem got really bad. I just couldn't take the itching anymore. I finally told my mom, and we had to shave my head completely. And goodbye to my long, beautiful, flowing hair. After that story, lice, or singular louse, they're little bastards that live on your body. They feed off your blood, and they're parasitic, meaning that they take from you and give nothing back.
Yes. Little bastards. Yes.
There's 3 forms. There's head lice, which is what most people associate with lice, body lice, and then pubic lice, more commonly known as crabs. Do you have some notes? Okay, so they reproduce pretty often. Every 2 weeks, they'll be produced. They lay eggs on the base of the hair shaft close to your scalp, and they are highly contagious. You can catch them with just general contact with infected people, or through contaminated items such as towels, sheets, brushes, bedding, hats, and all that. The contraindication is do not massage. It's an absolute contraindication until they take care of the problem.
Yeah. Yeah. Anything else? That was perfect, by the way, but I just didn't want to cut you off. Is that it?
That is it.
Perfect. Yeah, that's exactly right. So lice is highly contagious. If you ever want to have a really fun time going to a hair salon and tell them you have lice, they will literally throw you out the front door. They won't even talk to you because it's a nightmare for them. If it gets in the salon, it's a nightmare. I will be very honest with all of you because I think it's important to be. But lice is probably the reason that our floors are tiled in your labs now. Because we had a lice outbreak in the school, and if you have carpet around and all that kind of stuff, it's so hard to get rid of it. And we've got a hair, school here and massage and everything. We were just like, oh my God. Not dangerous, by the way. Lice is not dangerous. And little fun fact, by the way, especially for you, sir, with your long, beautiful hair. I used to have long hair too. Is that lice likes clean hair. Strangely enough, that doesn't mean it won't affect dirty hair, but it's not a sign of somebody who does not have good hygiene. Actually, lice loves clean hair, clean scalps. Really dirty hair and dirty scalps is actually a way to help prevent lice a little bit. The oils actually detract the lice. So strangely enough, sir, you had too good a hygiene and too beautiful a hair as a child, and they looked at you like, that's where I want to live. Yeah. And they are, yeah, and you got to comb out the eggs and everything like that. And anybody who's got kids and has ever taken them to school or a daycare or whatever has probably dealt with this at least once in their life because it just runs through the school. It's rampant. All right, but anyway, yeah, lice is, if somebody came in and said, I have lice, you'd ask them to leave. Or if you were doing a scalp massage and you saw lice, because you can see it, they look like tiny little bugs in their hair, you'd tell them and you'd end the massage, and I would burn the sheets and vacuum the floor around them. I really would. Again, not going to hurt anybody though. Good news, nobody's going to die, but could cause you a lot of headache. A lot of headache. Okay. Mr. Rydell. Mr. Rydell, yes, sir. You there? You can't back out now, sir.
I think he said he was going to the restroom.
Oh, okay, well that's a pretty good excuse. I think that's always important beforehand. Okay, well, then, let's see. Oh, Miss Suriel.
Hi.
Hi.
Okay, so the topic that it was like I should talk is about scars.
Yeah.
And scars are some marks. They can happen in every part of our body. They are caused by infections, burns, surgery, injuries, or sometimes inflammation of tissue. The scars they can look flat, lumpy, they can be sunken, they don't have a color. Sometimes, although they can be red, sometimes also they can be painful depending on what part of our body we have it, and also itchy. Usually scars, when they are healed, they have no hair follicles, and they don't have sweat glands. Scars are formed because our skin produces collagen. Collagen is the building block for bones, skin, muscles, tendons, and ligaments. Sometimes, so when we have like the wound or something, our skin starts producing a lot of collagen to heal that part, and that's why it leaves the scar. I don't know how to upload any pictures, but in here I have a picture of the types of scars that's the most usual. One is called hypertrophic, which is in the surface of the dermis. Then we have the keloid, which are the ones that sometimes they're over.
Yeah.
And then we have the atrophic scar, which can be the ones that are left by chickenpox or sometimes by acne. And here is another picture of the keloid scars, and you can see here how this is the tissue that is formed by the collagen. The treatment for scars, since they're not, some people they just treat them because it's embarrassing. It can be by laser or steroids. And as a last thing, I want to say that massage is recommended only when the scar is totally healed. If it's open, we can hurt the person, we can cause an infection. So we have to make sure that it's healed, it's closed, no fluids. And then what is recommended is that we apply a lot of oil, and that's it.
I love the clarity you speak with. Wow. It's when you say stuff, it's extremely clear. Yeah.
Thank you.
Thank you. So really well put and really clear about what we're supposed to do and not supposed to do. But the extra buildup of collagen, right? The extra steel, building up that area. And yes, we can work on them. And in fact, you can do cross-fiber friction, which is actually working against the scar to kind of re-injure it to help smooth it out. But we do that after it's completely healed. And that's really all you need to know about scars. That was really good. Thank you. Thank you. Mr. Rydell, you said you're back?
Yes.
And we would love to, hear from you.
All right. Well, first I want to say, it's always, almost at the worst time. Like, I waited to go to the bathroom for like a good 20 minutes. I was like, he's going to call me any minute, and I just couldn't take it anymore, so I stepped out. And I heard Mr. Rydell, and I was like, no.
They covered for you. They said you were going to the bathroom.
All right. So I was assigned psoriasis. This is a skin condition where the epidermal cells are replaced at a much faster rate than normal. This causes skin to become inflamed, appearing as red spots. Um, so these spots are buildup areas of accelerated skin growth. Psoriasis is perfectly okay to massage, and there is zero restrictions or contraindications, yeah, I think I said that right. And psoriasis is typically genetic, so it's not like, contagious.
Yeah. Yeah.
And that's
No, that is it. Like you can't make a presentation longer than the subject is, so to speak. It is another really common thing, and strangely enough, it can. What am I trying to think of here? Hold on. It can look a bit like. What am I trying to say? Why am I drawing a blank?
Eczema?
Yes, thank you. It can look a bit like eczema, and you can treat it the same way. It's not. They're both at the most local contraindications, but basically, if they're not bleeding and they're not open, they're nothing. Strangely enough, though, what makes them different is psoriasis is actually an overgrowth of skin, and that can be a problem too. So, a lot of problems in your body, by the way, aren't something truly, truly wrong. It's something doing too much or too little. Anyway, well done, sir. Thank you, and I'm glad you finished your presentation and you've gone to the bathroom now, so we're good.
Yes,
We're good.
I did.
Yes, good. Okay. All right, sounds good. Let's see who is next. Oh, Mr. Tate. Are you there?
Yeah, I'm here.
Okay. Can you tell?
Can you see me?
Yes, I can. I love it. All right, sir. What did you have to tell us about?
I can't see myself.
Oh, well, you look the same as you always do.
Oh, darn.
Did you want to see yourself?
Yes, please.
I don't know how to help you with this.
Yeah, me neither. Okay, yeah. Okay, so my topic was this.
Where did you go? Oh, there you go. Okay.
I'm ready. My topic was, I have to look at the word. Seborrheic dermatitis?
Yes, seborrheic dermatitis.
Yeah.
What is seborrheic dermatitis, sir?
Seborrheic dermatitis? Am I saying that right?
Yeah.
Seborrheic dermatitis. Okay, can you guys hear me okay with the computer?
We can.
Yeah. So, seborrheic dermatitis is commonly known and mistakenly called dandruff. Or, I guess I'm mistaken, but it's called dandruff when it's on his head. So, seborrheic dermatitis is the medical term. Seborrheic is referring to the location, and that is the seborrheic glands, and the dermatitis is inflammation of the skin. So it's a chronic condition, and the seborrheic gland is overproducing oil or sebum, and because of that, the sebum, the oil changes, and it changes, and it irritates the skin, and it inflames it, and has flakiness to it. Find this condition. You can find this condition normally where hair is, like on top of your head, on your chest, here, by the nose, on the eyelids. I have a picture. So I have pictures, multiple. I just can't see them, so sorry, but soon.
Let's see.
So here's in the hairline. This is a baby who has it. It's called cradle
cap.
Cradle.
Sorry, I didn't realize my mic was on. Cradle cap. It's called cradle cap.
Cradle cap.
Yeah.
Cradle cap. Yeah. I have. So about 10 to 20% of the people in the population have this condition. It's not contagious, and I have a lot of information about this. It's normally treated with with a shampoo, a cream, either topical or steroid. It's treated as with antifungal medication because there is a fungus that's on the skin that it I guess it overproduces and causes inflammation. The sebum seeps through the skin through the hair, and I have a picture of it right here. If you can see that.
You have to lift it up higher, sir.
Well, I'm sorry.
There you go.
I can't see, so yeah. Yeah. I can't see them, you know. So when you treat this, like when you guys have dandruff, when you wash your hair, it's more important that you get the scalp because that's where it's coming from. That's where the condition is located in the scalp. So just use your medicated shampoo and just be consistent with it because it's probably doing something. Just switch it up every 2 weeks and stay using it. Sorry. I have this all written down so I can read it, but I want to look at the screen because this is a presentation.
Don't put all that weight on your shoulders.
Okay, I think that's pretty much it. It can be on your ears, your face.
So just to repeat, just for everybody, it's not a contraindication at all, is it?
No, I think a massage can be a treatment for it.
Yes. Massage can actually be a treatment for it, everybody, because it stimulates circulation to the scalp where it's often found, things like that. And that's great. So flakiness in the scalp is actually really benefited by you massaging it. So bugs in the scalp, bad, but flakiness in the scalp, don't worry about it. Cool. Thank you. Thank you, sir. Thank you, thank you, thank you.
You're welcome.
Okay. And Miss Routson's not here. I don't know why I'm even calling her name, but I just am hoping she'll be like, yeah, I've been here. No, okay. Miss Vincent.
I was gonna say I have warts. No, I researched warts and wrote about that. So they are usually fairly small. They're non-cancerous growths that appear on the skin. They grow because of a virus, the human papillomavirus, usually shortened up HPV. The part of the wart that we can see is extra cell growth, and it usually appears, it's raised, it's thick, hard, and sometimes flaky. They can pop up anywhere on the body, but most commonly it's the hands and the feet, and then there's other strains that are unique to just certain areas of the body, but we won't see those in massage, so like genital warts. They are contagious, but not just coming in contact with them doesn't mean you will get them. It just depends on your immune system and how strong it's feeling at the moment. And I would say it's a local contraindication because they are contagious. So,
Yeah, well said. Yeah, if you notice warts, avoid them because they can be mildly contagious. I said if you notice them because sometimes they're so teeny tiny little things on people that you won't see them. They don't know they have them. You gotta really, it's just, you probably have rubbed somebody's wart before without even knowing it. But yeah, local contraindication if you notice them. And that means you just go around a little thing. Like you just avoid a little wart. Yeah, anything else? I don't have anything else to add to it. I'm just asking you.
no, that sums up my warts presentation.
Thank you very much. We loved your warts. Yes. Miss Walker, Miss Walker, why? You got skin cancer.
Yeah.
Please don't feel like, they teach whole courses on skin cancer. I was not expecting like a big thing. Just whatever you want to tell us. Tell us.
Okay. I have a little slide. Is it showing my screen?
Let's see. Yes, it is. We see skin cancer.
Okay. So skin cancer is the abnormal growth of skin cells, and there's 4 main types that I talked about.
Cool.
There's basal cell cancer, which is a type of cancer that begins in the basal cells, which we talked about yesterday. They're found at the bottom of the epidermis, the most outer layer of the skin, which produces new skin cells. And then there's melanoma, which is one of the more serious types of skin cancers. It begins in the melanocytes, don't know if I pronounced that right, which are the pigment-producing cells, which give color to the skin. And when they become cancerous, that's when you get melanoma. The third type is squamous.
Yeah, squamous.
Squamous cell carcinoma, which is a cell caused by an uncontrolled growth of abnormal squamous cells found in the upper part of the epidermis. And then Merkel cells cancer, which is formed when Merkel cells grow out of control. They're found in the top layer of the skin and are very close to the nerve endings, which receive the sensation of touch. And then I said that skin cancer is a local contraindication because even though it does affect your whole body, it's usually not on your whole body, so you just want to avoid the site. And then depending on if they're receiving any treatment, you want to avoid heat pressure.
Cool. Beautiful.
And the image on the left just shows the parts of the skin, or the layers of the skin that the cancer affects.
Yeah.
And melanoma goes the deepest.
Yeah. Very cool. Well done, by the way. I believe you are our last presenter, and I think we finished very strong, thanks to you. Yeah, skin cancer is really basically a local contraindication. Obviously, it's not contagious. The only thing is just remember to tell people when you see unusual stuff on spots of their body that they would never see. Yeah. So that's the big thing, because you could be saving their life from some little thing. I think that was everybody. Yes. Yes. All right. I mean this most sincerely. Some of you today, and I don't even necessarily know who you are. I'm not speaking necessarily to some of you. I do know who you are, but some I do not. Some of you today did something extremely brave. So what excites me about this is if you can do this, you can keep going to school, and you can get your massage license. So this is as hard as anything gets, really, is facing these kinds of fears and such. So I really appreciate you all showing up and teaching us something. I really do. I think we need a break, right? Let's take like a 12-minute break just because we need to kind of regroup and finish up the class really quickly. So we'll be back about 5:30, and we'll take it from there, okay? And thank you.